Hi, I'm Chelsea.
And I'm Sophie, and we are here to help guide you to the why behind your wellness why.
Come join us on our journey.
Hi, everybody. On today's podcast, we are going to talk everything physical therapy. We have a wonderful guest named Dan Wrzosek joining us today.
Woohoo!
And he is going to tell us a little bit about his background.
Take it away, Dan.
Hi, everyone. My name is Dan Wrzosek. I am an avid fan of podcasts. You guys produce some great content, and I'm excited to be on the show. A little bit about me. I am a Polish Chicagoan and a co-owner of Elevate Physical Therapy and Fitness. I grew up in Chicago, the city. Sophie will say that Jefferson Park isn't a part of the city. It's more like B-list city, but I did grow up in Chicago, went to Little Academy for high school, and then St. Louis University for my doctor of physical therapy. After school, I passed my orthopedic certified specialization, and then I worked at Athletico and Body Gears before starting my own company with my business partner, Sean McInerney. A couple of my hobbies are staying active and playing soccer. I grew up playing soccer for a Polish team, Wisła, then played in Highland Park, Chicago Wind, and walked on to play at St. Louis University. Unfortunately, I didn't get much playing time. So after 2 years, I stepped down and focused on my career on education. I am happy to say I continue to play soccer twice a week at the Chicago Fire Pitch with my friends. And I just love trying different sports and understanding the mechanics of what makes players great. I recently picked up tennis and I'm in love with getting good at it. I play with Sophie once in a while and she is really good. So hopefully one day I'll be able to beat her.
That was going to be my question is who wins, but you just answered that.
Me, always me.
I love it. Dan, what got you into physical therapy?
Yeah, my journey started through my soccer injuries, actually. I had a lumbar stress fracture. It was called lumbar spondylolisthesis, junior year of high school, and sidelined me for 6 months, which turned into some chronic low back pain into the future. So my curiosity of why it happened to me, how I can overcome some of the symptoms that I face later in my career, how to prevent future injuries and how to help other people in my situation, all started in that around that time. And in a selfish way, I wanted to continue to play soccer, enjoy my life without some of these issues. And it was a long journey, but I've learned a lot through it. And I feel like I understand a lot of the reasons why that initially happened. So I went to undergrad and grad school to get my doctorate of physical therapy. And after school, I experimented with a lot of different strategies to kind of overcome some of the pain because I was actually still having some of the chronic issues. Even though I did go through my schooling, I felt good, but anytime I try to do something harder, I would have some symptoms here and there. So just through trial and error and reading a lot of research, learning from important mentors, I found some useful insights and principles that allow me to continue playing twice a week now and playing at a higher level.
So with that, how has your physical therapy philosophy changed? Because it sounds like it's changed over the years with what you just said.
Yeah, so that's a good question. I was initially exposed to manual therapy and activation exercises. So using like foam rolling and different core and hip activation exercises to kind of help patients, but help myself too. And so I spent a lot of time trying to kind of understand it, and it was helpful. I felt really great, but never truly felt invisible as I do now. And I'd say that that came from when I was exposed to using resistance exercise to help repair injuries and prepare for exercises. There's a couple people that influenced me to kind of learn a little bit more about that area, which I would say is kind of what really progressed me to, who I am now and how I like to treat. Because I found that, true changes to your body takes resistance exercise to make that biological change in your body, where I maybe wasn't getting enough of that from my initial time as a physical therapist. Not to say I don't use some of that, but it's a little bit smaller part of my treatment and how I treat myself, where now I spend a little bit more time focusing on consistent and progressive exercise that challenges the area of the injury and help people get to a level that they're happy with, and a level that that allows them to enjoy life to its fullest.
Thanks for sharing that. And if we take a step back for a second, I think most people have heard the terminology physical therapy and know generally what it is, but can you talk a little bit more just about what is physical therapy and how you might integrate or work with other professionals, like a personal trainer, let's say, Sophie, let's say,
or a nutritionist?
and nutrition. I'd love to hear that too.
Yeah. Well, we are trained and licensed medical professionals that diagnose and treat a range of injuries, disabilities, and different conditions, anywhere from the hospital to home health to outpatient physical therapy is where I work. But in the simplest sense, we help people overcome their injury to get to their goal. So whenever someone does have pain or pain is affecting their lifestyle, I go through an examination looking at their range of motion, their strength, their movement, and we use special tests to help rule in or rule out specific injuries to help understand what they're dealing with, and then provide a plan to get to their goal. Something unique about our company at Elevate, we like to take a step further. So our company is called Elevate Physical Therapy and Fitness, because we want to blend physical therapy and fitness together so that people can live a healthier life. And so the reason behind that is because we learned that there's a minimum amount of exercise that everyone should be doing to get a good benefit health-wise. So they found that just doing the minimum of cardio and strength helps reduce the risk of all-cause mortality by 20%. And that's something that a lot of people don't know about. It's kind of like, what is the minimum? Because everyone hears that cardio and strength is helpful, but how often, how often should someone do it, and what are the benefits? And I find that people are just focusing on maybe the wrong things, and that's a really low-hanging fruit that not a lot of people are doing. So get a lot of questions about, should I do this? Should I do that? Do you believe this? And I do like answering those, but most of the time we're asking the wrong question. We're not doing the basics. And the basic is 150 minutes of cardio per week and about 2 days of strength training a week. And the research found that only 15-20% of the population is really taking advantage of this. So what we like to do is throughout the pain journey and the recovery process, we slowly integrate those cardio and strength habits. We educate on the benefits, because at the end of the day, it's a lot of times it's a habit that people form that create long-term changes. So as the person recovers, they learn about the advantages of cardio and strength training to live a healthier life, and provide them a simple program, or refer them to a personal trainer to continue their trajectory. But on top of that, nutrition is not my specialty, and that is the other, another huge part of living a healthier lifestyle. So if they are struggling with nutrition, that's when I'd refer them to an expert like yourself to just help them understand what's a low-hanging fruit that they can take advantage of, because there's just so much noise in the medical society that maybe we're just focusing on the wrong things. And if you just maybe do some of the simple things, we end up feeling a lot better, and we don't concentrate on some of those other things that we get confused about. So that's, I think, how the team works together, and how I like to work with personal trainers like Sophie and nutritionists like yourself.
I love that. We definitely all have a very similar philosophy, it sounds like. And Sophie and I talk so much about the basics and the foundation, and we've talked even more about that this summer. We just had a podcast about social summer and taking it back to the basics. But I think you make a really good point of like, that always should be focused on is all, the basics just are such a huge part of everything. And I love how you set your patients or clients, whatever you call them. I know it's different in every situation. Patients, is that what you say? Patients?
I use both.
Okay. Just wanted to make sure I was using the appropriate terminology, but it sounds like you really set them up for success, because I know even from my personal experience, sometimes you go to physical therapy and then when your sessions are done, it's kind of like, now what, so it's great that you have a referral system and start to even integrate some of those things in your practice. That's really, really awesome.
Yeah. And I'd say that's, another, that's a part of my philosophy. I want to give people the autonomy over their injury through education and exercise. So giving them the driver's seat in their own care versus me being the one to fix them. It's more of, I'm just being the person to help them down the journey and give them the resources to make the right decisions and to kind of help themselves in the future. A lot of times someone that does go through treatment with me will end up learning some of the principles to help maybe another injury that they had. I'll have a conversation with them later in life, and they had something that they had pain with, and they just tried something simple that was a part of my own philosophy that was able to kind of take care of the small thing that they were dealing with. So giving the autonomy back to the patient and client, providing them, the latest research and latest kind of ways to help themselves is important. Like I said before, there's a lot of noise out there, and it can be confusing unless you are spending your career learning it, because there's just an inherent risk in trusting a treatment, and failures around the corner, and just understanding things as a patient is always important to me, to kind of gain control over their injury. So outside of helping, so through education, exercise, two kind of simple principles I like to use at the clinic itself that people find to be helpful to help themselves in the future is using kind of recovery and exercise, the combination of the two, to help them with their injuries. So if someone does come in with an injury, it's finding ways to help reduce some of that pain. If that's, the reason why you keep flaring up is because you're running these distances. How about you reduce the distance and intensity, and then use exercise to stimulate adaptation in that tissue that you're injured at, and to help you get back to your goal. Unless it's more of an acute injury, understanding how long it does take, how to recover it using the crutch or a cane. A lot of times, I have this older runner who had chronic knee symptoms and would not want to use a cane, and understanding that it's just really short term. It's really to help reduce workload to the area as things heal, use exercise to help rebuild the tissue, and understand kind of the timeline, help them kind of be a little more comfortable with using a cane for 2 weeks before getting back to walking and progressing back to where they want to be. So, the two principles of recovery and exercise, and exercise is a very simple kind of word to use. I also like to use mechanotherapy or optimal loading, and it's just the idea of using resistance exercise to create a physiological response where cells sense and respond to the exercise and create the catalyst for tissue repair and remodeling, and to help adapt the tissue to handle the stresses that you're asking it to do. Where nothing like resistance actually does create that biological change that we want to create. And that's, in the simplest way, I think, what physical therapy is. We use exercise to help make a change in your body. And it has to be specific. It has to be just the right amount of exercise, where like not doing enough doesn't help, and doing too much is harmful too. And it's finding that kind of Goldilocks effect to create a little bit of stress, recover, and make that and appropriate adaptable changes over that 4 to 8 week mark, where it does take someone that knows the process to help people get to that endpoint.
Awesome. So much valuable information. I love it.
Dan, when and why should someone go to physical therapy, and can someone go to physical therapy?
Yeah, good question. So you should see a physical therapist when you have an injury that you're worried about, that that you keep thinking about, you're worried about the future, you're having trouble sleeping, or if you have pain with movement that's just not going away. You've just tried to wait and see, or you completely stop the activity that you love, and lastly, pain that is kind of limiting your lifestyle. So if you are injured and you're worried about it, I recommend going to see a physical therapist to kind of guide you to the next step, because what I've found is that conservative therapy, guided by a pain expert that examines your injury, can really help you get to your goal in an efficient and cost-effective way. And as a doctor of physical therapy, we are trained to be able to examine the injury and recommend the appropriate route. And in some situations, the injury, which is usually more traumatic, may not be appropriate for conservative therapy at the time and may need further imaging. So we may recommend following up with your primary care doctor to get maybe further imaging or other tests to make sure that what you are injured with, you're being taken care of. So we are trained to know if it is a musculoskeletal injury that can be treated by us, or if it needs a further follow-up to see your primary care doctor. And as far as people that I see, it's anyone with a musculoskeletal injury. I work with all age groups. Kind of three good examples is, your younger athlete that maybe had a hamstring injury, and instead of, and this brings up a nice example of, I had a younger athlete who had a hamstring injury playing soccer, and came to see me out of curiosity to see if there is something that could be done, because she knows I was a physical therapist, and she was shocked and surprised that there was that she didn't have to completely stop being active during that 3-4 week time period where she was just going to do a wait and see approach, where she was just going to wait for 4 weeks, take time to let things rest and heal. And she was surprised that, kind of how much there was to be done. You can maintain your fitness by doing an aerobic exercise that is safe for her at the time. So she was I got her to use elliptical and bike to help just maintain some aerobic fitness, while we used resistance exercise and mechanical therapy. So we were using tough exercises that were helping her hamstring recover. And research has found that a specific protocol in this situation helps an athlete get back to their sport faster. And I would have to review the article again, but they were just comparing two protocols for a hamstring injury, one that tested the hamstring and one that wasn't as challenging. And the player was able to get back by 14 days faster. And so after that whole experience, she got back on the field, and she felt confident and ready and resilient, versus when I was in high school and had a hamstring injury. I did do a wait and see approach because I just didn't know what to do. And I got back, and I remember just that, it didn't feel great. I didn't feel confident for a while until things kind of scarred down and was able to start handling things again. But kind of using a physical therapist to kind of guide you through that journey helps you understand the injury and gets you to your goal in a confident and resilient way. Two other kind of groups that I work with regularly are, your middle age group with, low back symptoms, shoulder injuries, knee injuries. Usually, with low back, there's some fear of using their back, and they have continuous flare-ups, fear of lifting things in the future, where, again, we kind of use education to help teach them that pain isn't something to be scared about. It's a natural response. But with the right plan, your mind and body kind of are able to overcome it by gradually exposing them to those movements, where we do use some core exercises to help improve their lumbar ability to handle stresses, but then gradually go into some fearful movements like lifting from the ground. We start with something light, and through staying consistent, we progress them up to 50, 60 pounds fairly quickly. And I do that with a lot of people. I have 67-year-olds getting up to 60 pounds over a course of 6 to 8 weeks. And it depends on their tolerance and how ready they are. I never try to push people beyond what they're comfortable with. But once you understand kind of why someone's having pain, and understanding the plan and where the plan is taking them, the body and mind are pretty resilient, as long as they stay consistent and they understand the game plan. And so then, like, the last group I like to work with too are seniors. So seniors, there's a little bit more fear about walking by themselves because of the risk of falling, which can lead to bigger injuries. And it makes sense. So in that way, we help them get on a cardio strength program that's individually specific to them, and systematically get them to get to their goal. some other things that we help with are anywhere from vertigo. I've worked with some stroke patients. But in all these situations, it's always good to have a team to help them get back to where they need to be. So you guys work with physical therapists?
Yeah, I love working with physical therapists. And this kind of leads to the next question I was going to ask you. But what I see from my clients, and when we have conversations about movement and exercise, of course, I'm a dietitian, so mostly what we talk about is nutrition, but a lot of times nutrition, we go back to the basics of like what is happening in your daily life. So things like, of course, sleep, movement, all of that type of stuff comes up, and we talk about all of that. And one of the things that I see the most with physical therapy and clientele is the unknown of how to even start. So that was going to be my next question was, can you tell us a little bit about like, okay, if you feel, if you fall into that category or any of those categories you just mentioned of maybe wanting to go to physical therapy, what's the process of that? Like, can you just call? Do you need a referral? And then a follow-up question that I would have that I think would be really helpful for individuals to know is like, what does a typical session look like? I know that probably differs, but how long are they? What do they look like? So if someone has never done physical therapy, they feel a little bit more comfortable going into that setting.
Great question. So in the state of Illinois, you do not need a referral to get a physical therapy evaluation. You can schedule an evaluation today, tomorrow, just by giving us a call. You can also schedule through our website. Our company specifically in Chicago, we accept all major insurances, including Blue Cross Blue Shield, United Healthcare, and Medicare. Typically, a typical evaluation and a visit with us is about an hour. So Sean and I pride ourselves for being one-on-one healthcare professionals, where we spend the entire time to really understand the person's injury and understand what they're dealing with. Where then we do the examination based on their goals. So oftentimes we try to find, what are the things that they are missing out on because of their pain or injury, and we try to examine the things that are limiting them to that goal, and then create a plan that systematically gets them to that goal. So if it's someone that has hip pain and can't walk as much, has to use a cane, we do an assessment on their range of motion, their strength, and what their prior history is, and then come up with a plan of systematically progressing them back to where they want to be. So as far as each evaluation, we try to kind of tailor their injury with their goal and come up with a plan. And that could take anywhere from 4 weeks to 12 weeks, depending on your situation. And we are flexible to help people with their schedule and help them kind of get to their goal if they need more assistance or if they need less assistance. As long as there's open communication, we find a way to get them to where they need to be.
Sounds great. Thanks for sharing that.
So Dan, why does an injury typically occur, and is it possible to prevent any injuries?
Yeah, so injuries, there's multi factors that play a role, but in a very simple sense, it's when the tissue just can't handle the task that you're asking it to do. And because of how complex an injury can be, we can't prevent injuries, but we can reduce the risk for an injury. And risk factors include maybe flexibility, fatigue, lack of proper warm up, previous injury, strength deficits. But there is research on how to reduce risk for injury, and this always surprises people because what the research has found, and this is specifically with sports. With sports, the systematic review found that strength training reduces the risk for injuries up to 69%. Versus other types of exercise. So you can't completely prevent an injury, but we can reduce the risk of it happening. And this study looked at, what's the best exercise to help reduce the injury. They looked at strength training, they looked at balance, they looked at like a multi-model, and they looked at stretching. And the one that was the most beneficial was strength training versus do you know how effective stretching is for reducing a risk for an injury based on this study? The study said it was like 9%, which always surprises everyone. And after kind of learning a little bit more about that, it's not that I don't stretch. There's a time and place for it, but it's more of, knowing the priority of what is most helpful for the specific client and the situation. And if you are an athlete and you're trying to reduce the risk for an injury, knowing some of that data is helpful, and knowing that maybe if you do only have so much time in your week and your day, I would recommend doing strength training first, and then if you have more time, then adding stretching into your routine. And as far as reducing the risk of injuries for, what kind of strength training should we be doing? That's when I get into more needs analysis for the specific sport itself. I work with a lot of runners, and we do some lectures for running groups where we talk about top 5 injuries and exercise to help with that. Well, in running, we do a needs analysis. So we look at, what are the most injured body parts, and that's the tissue we should probably strengthen to help reduce the risk of it happening. So for runners, the top 5 body parts that are injured, to no surprise, is the lower body. It's your hip, your knee, so that's patellar tendinopathy, and then we have our foot, which is the plantar fascia, your Achilles, and your shin splints. And that's because that's where all the forces are going. And it's injuries usually happen when, the forces add up and the tissues break down and start causing symptoms. So to help reduce that, I recommend doing strength training to those tissues that are often injured. So for your knee and hip, that's your split squat. For your ankle, that's your heel raises and your toe raises. So at the gym, you'll find me doing a lot of heel raises just because as a soccer player, that's something that I've had injured in the past, but I also want to reduce the risk of injuries. So those are a lot of the common exercises that I do too. And because of my prior injuries myself and wanting to continue playing, I dig into this, and I've been fortunate to have some smart people kind of give me the right direction to kind of find the right things to do and to help with. And before I give anyone advice, I always like to make sure that this is something that I can do and I'm happy when it makes sense. So as I looked at the research and learned more about this, I find that this is extremely helpful for anyone that does get injured and wants to reduce the risk for injuries.
Yeah. And you kind of already answered this, but it sounds like with physical therapy exercises, all of these exercises you're learning in physical therapy, you can utilize after physical therapy. And what about in between sessions? Again, I'm sure this varies person to person, but do you prescribe like a regimen outside of their sessions as well?
Yeah, and I'm pretty flexible in how I approach that, and I think Sean approaches it too. Sean and I both work very in a similar way, but I'm understanding because we are busy individuals. We only have so much time in our day, so we want to be as effective and as efficient as possible. So I try to keep it to 2 or 3 exercises that we do in the clinic and they do themselves. And because of the nature of how I look at physical therapy, it's a progressive exercise program where once the tissues are adapted and are able to handle a specific intensity and movement, there's a progression to the next level where the exercises are progressed to being harder and more worthwhile. So it's usually in a conversation how much the client or patient is able to do that week, what their goals are, and we set up a plan to what they can do. So if it's someone that really does not like doing things by themselves, then we find at least one thing that they can do that's a part of their routine that may be helpful. And as long as they know the expectations, they know what to do. I work with them to get to their goal. And because one of the risk factors for an injury is a previous injury, typically I keep 2 or 3 exercise pretty constant throughout their progression, but just make them harder, where they will I recommend them continue doing after we get done. That's a part of, and they usually look like a strength exercise, where you would see them at the gym doing this exercise and think they're just working out, but in reality, it's more of kind of what's the reason behind it. So a split squat is a great strength exercise, but it's also great to help recover from a knee injury and reduce the risk for knee pain in the future. And that's when, if it's someone that can handle a general program and they have good exercise background, then they continue doing that. But if they need more help, that's when I would let Sophie take over so that she can continue progressing them later into their life.
I'm all about it. I love the amount of strength training you do. It's great, and what the people need.
Heck yeah.
So Dan, where can people find you if they need your help?
Yeah, so we have 2 locations in River Forest and Franklin Park. You can give us a call at 847-447-3098, or you can email us at info@elevateptaf.com, or visit our website to find more of that information. The website is elevatephysicaltherapyandfitness.com. So again, we help people with injury overcome their pain through one-on-one care and innovative treatments like optimal loading, so that you can get to your goal.
And we will link all of that information in the notes of this section. So if you want to head to the notes, you can click on all of that information. Thank you so much, Dan. Is there anything that we're missing, Sophie, or anything from your end, Dan, that you think would be helpful last minute information before we wrap up for today?
No, I think we tackled everything I like to talk about as far as just an intro to PT and what we help with and kind of the things that makes us different. And I want to just thank you two so much for having me on. I had a blast, and I look forward to your future podcasts. You guys rock.
Thanks, Dan.
Thanks, Dan.